first, live, local. This is Fox 12 Now.
Hello, everyone. This is Fox 12 Now. I'm Gray Nibbler. Thank you very much for joining us. We are live streaming here out of the Fox 12 Oregon newsroom. This is something we do every weekday starting at 1 p.m. We go throughout the afternoon. We cover a wide range of topics. What you're about to watch is a news segment from InvestigateTV, Joce Sterman being the reporter, called Doctors of Defense, the Whistleblower. And it's really an extensive look at some issues that are going on at the Defense Health Agency and some of the concerns that a whistleblower has about that. So you've probably or maybe seen some of the shorter versions of this. This is the longer version. And after we run this for you, I actually spoke to Joce just a little bit more to go in depth on some of the issues that are brought up during this segment and some of the things that she has found also, and potentially what could be happening going forward. So let's go right into it now.
Because there's a number of things that I've encountered in the military that haunt me.
It's not war stories from the battlefields of Afghanistan or nightmares about fallen soldiers in Iraq. Fire! The haunting images that keep this veteran up at night come from what he witnessed somewhere unexpected. Military hospitals right here at home.
But once you get into the system and you see behind the curtain, I think it's a much more jolting reality.
A reality this Ivy League educated surgeon has lived with for 2 decades, working at half a dozen of the military's most prestigious hospitals, including Walter Reed in Maryland and Balboa Naval Hospital in California. We're concealing his identity because he's still considered active duty.
And you've seen cases, even if you didn't participate in them, where patients died as a result of misconduct or problems with providers?
Yes.
How do you react to that when it happens?
Disbelief at first, shock, surprise.
But after seeing dangerous shortcomings in military medicine become routine during his career, he says he tried speaking out.
I have written letters. I have gone through the formal channels, and it's achieved absolutely nothing.
So he turned to us. For nearly 2 years, this whistleblower has provided information as our national investigative team reported on military malpractice and the lack of transparency that allows problem medical providers to remain in the shadows, protected in a system run by the Defense Health Agency, which oversees health care for service members. In a report last year, we used confidential medical records he supplied to show how the military evaluates the potential for discipline or liability when service members or their families are harmed at the hands of military providers. Those records show mistakes, misjudgments, even missing equipment that contributed to death and serious injuries. But military families never see these records. They're left in the dark about what causes the tragedies that change their lives and whether the medical providers involved are punished.
I would say well over 95% of the scenarios where harm has been done, it never sees the sunlight. It stays contained.
But our source is now putting it out there, exposing problems he says only people inside the military's insulated system can know.
They achieve levels of absurdity, the things that happen in these military health centers for lack of attention, lack of funding, lack of highly skilled personnel, high turnover rate, lack of equipment, lack of adequate training, lack of adequate volume.
That last one, volume, our source says, is one of the military's biggest problems. It's an issue that puts patients nationwide at serious risk because research shows higher volume is tied to better surgical outcomes.
So in order to perform at a really high level, particularly in the surgical world, it's about volume, how many times you repeatedly do a certain case. And it's not even just about the surgeon who has the volume, it's about that surgeon's team. That is part of providing excellent care.
But our investigation discovered most military treatment facilities are inexperienced when it comes to major surgeries with massive stakes. The military doesn't directly release information about volume, but we found it does voluntarily report some information to a nonprofit called Leapfrog that collects and reports hospital data we analyzed.
We verify it at Leapfrog, but we're getting it from them. They're already making it public, and I think that's to their credit. I think they need to do even more, but they've already shown enormous leadership, and their level of effort around transparency exceeds what we've seen in many, many civilian hospitals.
By pulling back the curtain, they're exposing something stunning. We found not a single hospital, none of the dozens of military facilities included in Leapfrog's data for the last 2 years, hit the established minimum volume standard for 7 of the 10 complex surgeries measured by Leapfrog and other recognized experts. We're talking about everything from certain open heart surgeries to lung and pancreas procedures often used in cancer treatment. Only a handful of military hospitals report even doing these types of surgeries, and not in high numbers. Even with more common procedures like knee or hip replacements or bariatric weight loss surgeries, which are done by more military hospitals, still only a few hit the volume standard.
If you're very, very low volume, it's like you're on that really steep acceleration. Your risk of harm is very, very high.
Dr. Peter Pronovost with University Hospitals in Cleveland is one of the nation's leading healthcare quality experts. He not only works with Leapfrog developing standards, he also consulted with the military in 2014 to help make improvements in its medical system. He says the stats on surgical volume raise alarms.
The data is so compelling, if you don't do something, you don't do it very well.
They need repetition.
Correct, yeah, just like anything else. I mean, whether it's being a virtuoso pianist, or a chess player, or a basketball player, or working on a high-risk procedures, doing 1 or 2 a year is not going to get excellence.
But some of the most prestigious military hospitals across the nation are rarely doing certain high-risk, complex procedures. The Leapfrog data we examined shows Walter Reed, considered the gold standard in military healthcare, has done just 15 open aortic heart surgeries since the start of 2023, when the minimum standard is 10 per year. The facility has done less than 20 lung resections in the last 3 years. To hit the standard, they'd have to do 6 times that many. In that same time frame, the data shows Tripler Army Medical Center in Hawaii has only performed each of those surgeries a maximum of 9 times. They're not doing these surgeries very often. What do you say to the Department of Defense or the service members who have no choice?
The warfighters should know how many that you're doing. Second is you should make an effort to make sure that you can get centers of excellence, and that might be consolidating within the military treatment hospitals, that you do certain things at high volume and you rotate the surgeons and the teams so they get excellence.
But excellence may be compromised by another factor we found lacking in the military system: board certification for doctors. Leapfrog's data shows that for the last 2 years, at least 2/3 of the military hospitals that reported didn't require that certification.
Do you see that as a problem?
Yeah, I mean, board certification is a very basic measure of competency. It's imperfect, like almost every quality measure is, but without a doubt, I would say virtually all leading civilian health systems require to be board certified.
This government needs to abandon the idea, I mean, really the delusion, that the United States military is able, at least the United States military health system is able to operate or function at a level on par with a Johns Hopkins or a Mayo Clinic or a Cleveland Clinic.
The Defense Health Agency has frequently touted high Leapfrog grades and recognition from the American College of Surgeons for some of its hospitals to counter that argument. But it wouldn't talk about that with us, or the idea of potentially hubbing certain surgeries at specific hospitals to increase volume and create centers of excellence, as suggested by our whistleblower, Dr. Pronovost, and other experts. We repeatedly contacted the DHA starting more than 2 months ago, as well as 5 specific military hospitals, and even the Secretary of Defense himself. None would do interviews or answer questions sent by our team.
Why should we keep fighting for information when the military gives us so little?
I mean, I think, the good fight is never done, and I think what you guys are doing is a good thing, and I think you should keep pushing on it. And one of the greatest lessons that the military ever taught me is don't ever accept defeat. So I think you're on a righteous path, and I think it's meritorious, and I think you should continue.
Now, the DHA and the individual hospitals that we contact all reference the government shutdown for the reason why they couldn't answer our specific questions. And we should tell you that we did ask them what strategies the military has for making sure its surgeons get more experience and whether they have been contracting out military physicians to civilian hospitals, because we know service members often end up in those facilities when their needs can't be met on base. Greg?
Yeah, I mean, it's really is alarming just watching this report, too, to see what is going on there and what this whistleblower is talking about. You know, one of the things they did address is surgical volume. And I wondered if you could just give a little bit more of an explainer on what that is and why that matters so much, both for these kinds of facilities and even, you know, regular facilities that people might be going to.
Absolutely. It's critical information for any patient who's going to have surgery, regardless of whether you're in the military or if you're going to the hospital down the street as a civilian. Surgical volume is all about repetition, not just for the surgeon who's actually doing the surgery, but for the entire team, the hospital itself. And research has shown that there is a direct link between that repetition, that volume, and better surgical outcomes. So having that information is really critical when you're making the decision about which doctor performs the procedure or which hospital performs the procedure. But unfortunately, surgical volume data is not widely distributed. In fact, Leapfrog, where we got the data from, is a nonprofit, and they're pretty much the only game in town, Greg, putting this information out there for the public to see.
Wow, so something that anybody would actually want to take a look at then, if you could get that information, you know, before you go in. And it makes sense. I mean, the other issue too that was in this is just talking about board certification and some of the issues associated with that. And could you talk to us just a little bit about that and how that's being, you know, handled within this organization, within the DHA?
Yeah. The board certification issue was very surprising to us. Again, we're looking at the Leapfrog data, and they're asking the hospitals whether or not they require this board certification for any provider who has privileges. So we're talking about doctors or licensed nurse practitioners, people at a certain level. And that board certification is something that experts tell us in the healthcare quality field is a basic measure of competency. And what we found is that throughout the military, the dozens of hospitals that voluntarily supplied their information to Leapfrog, more than 2/3 of these hospitals across the country that are run by the military do not require that board certification. So that definitely raised alarms for us, Greg.
When it comes to the whistleblower himself, too, I mean, it's a lot of information that he gave out there, and obviously taking a risk being there within, you know, this organization for so long. You know, what are some of the steps that would be possible to rectify some of these situations, or did he have any ideas on how that would work?
He definitely has ideas, and so do other experts that we spoke to on this front. Many of them talked about, for the military, creating these so-called centers of excellence, which is essentially just hubbing procedures in a couple of different locations and bringing the surgical teams there, maybe even rotating them through, so that way they increase volume, they get the surgeons experience that they need. But the problem with that is then that's going to put the onus on the service member to potentially have to travel far to get a procedure. They might have to take time off from work. They might not be and have the support of their family. So it's a solid idea that many people have spoken to us about, but it is one that does put some challenges back on the service member.
Yeah, that implementation does seem like that would be an issue. You addressed this too, but I just wanted to ask again, you know, when it comes to the DHA or Department of Defense or any of those organizations, I know you reached out, but it sounds like they're saying that because of the government shutdown, they couldn't talk to you. Was there any information that you could gain from them, or is it just pretty much radio silence from them?
It has been radio silence, to be honest, and we started asking these questions and presenting our findings to them months ago. So this is long before the government shutdown. It's just what we're being told is the reason why they couldn't answer questions now, which is problematic for us because we've been opening the lines of communication, asking for interviews, not just with the DHA, but also with the Secretary of Defense himself, not getting a response from any of them, and then being told after the fact, well, it's the government shutdown and we can't talk to you right now.
Wow. Yeah, that's, we'll see, I guess, what happens after the government is not shut down, if those answers continue to be the same as they were before. But Joce, you know, thank you very much for joining us here, too, and just, you know, illuminating this issue that is going on for so many people. I mean, it really is a shocking report, and a lot to be learned from this, and hopefully we'll get some of those answers at some point from the Department of Defense, or at least, you know, maybe be able to rectify some of these issues that are going on there. So, Joce, thanks so much for being here with us. I really appreciate it.
No, thank you.
All right, so again, thank you to Joce for joining us. Really fascinating and unfortunate situation, it sounds like, according to the whistleblower. So a lot of information to be gleaned from that. And once we find out more, once Joce finds out more, we'll of course bring you that as well. But thanks for joining us. This is Fox 12 Now. I'm Greg Nibbler. We are live streaming here out of the Fox 12 Oregon newsroom as we do every weekday. Don't forget, you can send me an email, fox12now@kptv.com. If you do have any suggestions, or maybe there's a topic you'd like to hear more about and do a deeper dive like we just did with this one, that's sometimes something we can arrange. So feel free to send me that email. But we'll talk